hospital. One was because of the pain, but also, of course, as you all know, the nurses were coming in to check my vitals. They were coming in to empty my drains and to also give me pain medicine. So with the pain medicine builds up in your system. So it takes a day or so before it builds up, before you are kind of not pain free, but comfortable. So that's why that first day or two, or day 0, day 1, I felt a little bit more of the tightness, the pressure and pain in my chest. So also on that Saturday morning, my doctor, my plastic surgeon, came to visit me. He spent about 30 minutes talking to us. It was, the Saturday morning. He didn't have anywhere else to be. So he was like, ask all the questions you want. And he spent a good 30 minutes talking to me and my parents about, but a few things that I wanted to share that he told me was, one, breathing while at home. So I received this little breathing device to practice deep breathing, to obviously help avoid pneumonia and things like that. So he highly encouraged me. He said, take it home, please do it. He said, people call us with fevers and, it's because they're not taking those deep breaths. So I do this every 1 to 2 hours the first few days. Then after that, I'll do it about 4 times a day. The next thing was pain management. He highly encouraged me to stay on top of the meds. So the medication he prescribed, hydrocodone, was supposed to be taken every 4 to 6 hours. He said, stay on top of that, set your alarm, wake up in the middle of the night if you need to, but stay on top of those medications. And then I could start tapering off on Monday, or maybe 3 days after surgery. I could start tapering off on those narcotics, I guess. And then the next thing is regular movement. So obviously I can't lift my arms above my head. I can't work out and things like that. But he said regular movement, like brushing my teeth, combing my hair, brushing my hair, whatever, things like that. Things, just kind of the regular movement that would move my arms around to prevent any type of frozen shoulder. So my nurse, Lori, also highly encouraged movement as well. She encouraged me to, get up maybe every hour or so, or every time I used the bathroom when I got home, and do a few laps around the house. So that would help move the fluid around in your body and help kind of the fluid drain into the drains as well. And then she also encouraged laying or sleeping at a 30-degree angle. So in the hospital, it's really nice because they have the degrees on the bed and you can set it that way. So at home, it's a little bit more difficult to figure it out, but basically kind of lawn chair position or beach chair position. And she said that would help the fluid go to the back instead of being at the front and you feeling so much pressure and tightness in your chest. But the movement itself, really moving around, really helps move the fluid and tightness and things in your chest to help with recovery as well.